Since the pandemic began, mental health has been a big topic we've been focusing on. It's been tough for everyone for more than a year, and that includes children.
In fact, health experts have recently declared the mental health crisis among children a national emergency.
So what can be done to keep it from getting worse and help out our children get past this? Morning anchor and health reporter Kirsten O'Connor is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Well, according to that declaration, the concerns when it comes to childhood mental health have risen over the past decade. But of course, in the past year, the pandemic and racial inequality issues have made the problem even worse. So I have Dr. Monica Barreto with me now, a clinical psychologist with Orlando Health. We appreciate you coming back and joining us for this segment.
Thank you for having me.
So when you hear that it's a declaration and it's a national problem, as a parent, it becomes a little more concerning maybe than a regular diagnosis or something that you've heard from a friend. What have you been seeing over the past year that maybe has added to that declaration?
Yeah, and I think when we think about what they're calling either the mental health crisis or the mental health emergency in kids, is we're seeing a lot more of it. During the year of the pandemic, we saw, just as we've seen in adults, a lot of isolation. Kids are removed from their friends, or removed from their regular schedule. Often when we want, we're working with parents about behavioral concerns or anxiety or depression, we always push structure and activities and getting them out there, and all of those things were removed during the pandemic. So we've definitely been seeing a lot more depression, a lot more anxiety, and different difficulties that children are talking about, or parents are now seeing because the kids are home,
right,
have been a lot more often.
I remember talking about it very early on in the pandemic, almost like we could see it coming. We knew this was going to be an issue for kids, especially with them out of school. So what are some strategies that you've given parents to try and have those conversations, those age-appropriate conversations with their kids?
Yes, and now we're seeing a little bit different because now kids are getting back to school and really helping families feel comfortable in getting back to those outside activities, back to their normal routines. One thing that has been very helpful for parents is not knowing what words to say, but bringing books. There's lots of great books that we can find online about talking about feelings in general, talking about anxiety, kind of doing something together at night. We read a book for bedtime, doing that way, just introducing. And the more parents, as you model, the kids are going to feel more comfortable doing it. They're seeing the parents do it. They're seeing their parents talk about their feelings and making sure it's important to be active. They're going to follow suit and make it feel safe to talk about those things.
And I know teenagers can be tough to try and negotiate with, especially if they're not wanting to read an extra book that's not on their reading list. But when you talk about modeling, we did see some role models like Simone Biles come out and talk about mental health recently. So I think that is maybe the start of a conversation for parents.
And I thought there was, was a lot of controversy around that topic and Simone Biles in the Olympics. And as a clinical psychologist, I thought it was a wonderful thing. One, to see someone at that level put their mental health. It's, one important thing that we do, especially as pediatric psychologists, is working with children and families. The mind and the physical body is one. We shouldn't be separating those. How we're feeling, how we're functioning in our day-to-day emotionally is going to impact our overall functioning in school, at work. So I think it's a great platform to let's talk about it, and especially normalize it. It's okay to not be okay. And I think that's something that Simone Biles has been able to provide, and now has been, championing, talking about mental health and making it, it's okay. It's not something that we need to hide or hush. I'm going to see a psychologist. We can talk about those things, and it's really important, and I think it's really good.
And you just said that it's okay to not be okay. I have seen that plastered all over social media. I feel like it's been on billboards all over the place.
Yes.
But what does that really mean? I mean, if you have a child come to you and say, I don't want to play my sport anymore. I don't want to do the thing that, is socializing me and is a part of my daily activity. How does a parent respond to that?
One of the things is to let's really think about and talk about what's behind that. Is it social anxiety? Is it they're comparing themselves to other athletes? Why is it that they don't want to do what they used to love? And really addressing that before saying, okay, let's not do it anymore. Like in that situation, she mentally wasn't feeling okay, or so she decided her mental health. Let's say a kiddo isn't feeling good or isn't enjoying ballet, talking about why. What are they feeling when they go? What are they feeling when they go to soccer? And really sitting down and talking about it so we can find, is it the sport that isn't a good fit, or is it something else?
And what's one more thing that you'd like parents to know as far as encouraging words and encouraging those conversations with their kids right now? Because this is obviously a very serious issue.
I would say one thing is really when you approach that conversation, don't come of it trying to get answers. Sometimes your children are listening, but they may not want to open up in that moment. And it's okay for you to open up and express yourself and just let them know when they're ready, you're there to listen.
All right, Dr. Barreto, thank you so much.
Thank you for
Great
having
to
me.
talk with you.
Good to talk.